Welcome to our BPW Asia Pacific her footprint program. Today, we are very happy to have our sub-regional coordinator for East Asia, Dr. Nobuko Kurosaki, with us. Hello, Dr. Nobuko.
Hello, how are you?
Dr. Nobuko has been
Yes.
very active, and then she is a medical doctor by training. She also served as former president for Doctors Without Border Japan for a few years.
Mhm.
So today we are very honored to invite her to share with us her life story. Okay, Dr. Nobuko, can you tell us a little bit about what are you best known for?
As you said, I am best known for my action or the activity in Doctors Without Borders.
You tell us a little bit more. How do you become a doctor, a female doctor, and then how did you join Doctors Without the Border in the first place? Yeah.
Okay, so my father was a doctor, then my
Mm-hmm.
mother was nurse, but
Mm-hmm.
um, they come from a little bit poor family. Then
Mm-hmm.
my father worked hard every day, almost every day, even on
Mm-hmm.
Sunday. But
Mm-hmm.
they looks very happy talk about their patient. So
Mm-hmm.
I believe the doctor is a very best professional profession.
Wow.
So I would like to become. I
Mm-hmm.
always said I'll be a doctor, even in my
Mm-hmm.
age of 3 or 4.
Wow, at age of 3 or 4
Yeah,
already.
but
Uh,
one of my father's friends said to me, he is doctor and he was a
mhm,
cardiac surgeon. He said to
mhm,
me, Nobuko, the best happiest time for the woman is marriage. So you
mm,
shouldn't be a doctor. So
mm,
I have decided to be a doctor.
mhm.
I don't want to follow his advice.
Wow.
He makes me very strong. I thank
Yes,
him.
yes. Mhm.
Yeah.
Yes. That's a very good starting point. Is it common in Japan for female to choose a profession such as a doctor, a very professional career, than, for example, marriage?
In my age, there is a one grade for
Mm-hmm.
120 student, medical
Mm-hmm.
school student,
Yes.
but only 5 to 8. It means less than 7% of is
Mm,
women. But nowadays,
right.
almost 40,
Mhm.
40%.
Wow, 40%.
Yeah,
Okay.
I think
Mm,
the percentage is increasing every year.
mm.
But
But
it looks very difficult to continue
mm,
to work as a doctor after marriage, not marriage, after having a baby nowadays.
mm.
So
Yes, yes.
also also working as some female doctors organization.
Mm-hmm.
I encourage them to continue.
Mm-hmm.
Don't give up. Please try
Mm-hmm.
to continue as a doctor. Yeah,
Right, right.
yeah.
Um, so you are single?
Yes.
Do
Fortunately.
Yeah, fortunately, I'm single too.
So
Yeah.
it means
Mm.
single, but it's very easy to make a decision by myself,
Yes,
everything.
yes,
And
yes.
also my father's always, he died 7 years ago, but he
Mm-hmm.
always supporting me.
Mm.
My, I
Yes.
don't know my mother, but yeah.
Mm-hmm. Mm-hmm.
And also
Yes.
you are, about your question, I'm a doctor, but I was surgeon.
Mm. Mm-hmm.
And I selected my profession as a surgeon, and especially for pediatric surgeon. So
Yes.
I don't know what the image of surgeon is. Looks
Mm.
very busy and tough,
Mm.
but
Mm-hmm.
pediatric surgeon is a different career.
Mm,
It means
mm,
I need to care of the baby patient, but
yeah.
not only for the family, especially for mother.
Mm, mm,
So
mm,
my first year,
mm,
there is a baby for the
mm.
20 like a Down syndrome.
Yes.
The baby's father asked me, don't
Mm,
treat him. They are not
the baby.
happy. Yeah, they are not
Mm,
happy
mm,
because
mm.
some
Yes, the
difficulty
Down
to care. Yeah,
syndrome. Yes.
but mother want to do that.
Mm,
Mother different opinion. But at that
mm,
time, the decision making is always father. So
mm,
I was very shocked. So
mm,
this is one of the reasons too. I'm continue to become a BPW member.
mm.
Yeah,
Yes. Yes. Women should have more say
yeah,
about many decisions. Either
yeah,
it's family decision, career decision, or
yeah,
personal decisions.
yeah. Next year, my 40 years anniversary.
Wow,
I became a
40.
I became a BPW member in Nagasaki
Yes.
when I was 29 years old.
Same as me. I joined BPW when I received my PhD degree and start first year teaching at the
Mhm.
university. And then I remember my former PhD advisor. She was the founding president of BPW in my
Wow.
city in Kaohsiung. And
Mm.
so she invited me and I joined. And I'm very honored to meet so many women with different
Yeah,
professional background. You know.
yeah, that's right. Yeah, I think so.
Yes. Um, how about Doctors Without Border? How long have you been joined this, and then what is the initial motivation for you to go, and then where have you been?
Actually, my colleague joined for the 30s, but I joined when I was 43 years old.
Mm-hmm.
Mm, I, I, at that time, I worked at the university hospital. I
Yes.
tried to be more professional. I would like to be
Mm-hmm.
a first female professor, but it was very
Mm-hmm.
difficult.
Yes.
Then I thought, okay, I'll try to another thing. There is one
Mm-hmm.
challenge. But unfortunately, no. I discussed with my professor. He
Mm-hmm.
said, uh, I couldn't not stop, but I couldn't take a vacation for working for the Doctors Without Borders. He said
Mm-hmm.
to me, if you want to join Doctors Without Borders, you should
Mm-hmm.
quit your position.
Oh, really? You cannot do both?
No, it's because university hospital is in a national
I
hospital.
see.
Yeah.
Yes.
So
Mm-hmm.
there is no choice. Okay. I'm planning to go back to university hospital, but okay. Which is best. So I will try to do work for the Doctors Without Borders. But this decision is not, for me, it's best.
Mm.
I
Yes.
had learned a lot.
Yeah.
So,
Yeah. I imagine.
so I joined for Doctors Without Borders in 2001.
Mm-hmm.
Then I became a board member. Then
Mm-hmm.
I was selected as a president for 2010, then
Wow. Mm-hmm.
2015, like for 5 years. So
Mm.
this during my presidency, there is a big earthquake in Japan, and
Mm.
also the last 2 years there is Ebola in Africa.
Wow.
So
Mm.
then after my presidency, I tried to continue as a board member. Yeah.
Mm-hmm. Mm-hmm.
Then this is my first mission in Sri Lanka.
Mm-hmm.
I'm very young, so
Where are you? Oh.
it's center of the front
Ah,
line.
okay.
Yeah.
Yes. Mm-hmm.
Then this is I worked Sri Lanka 3 times. So
Mm.
2007, maybe
Yes.
you can show
Yes.
me
Yes.
and
2007.
another two doctor is three Japanese
Mm.
female doctors work one project. It's very rare case. Yeah.
Yes.
Then last time in Sri Lanka, 2009, it's very serious condition with political condition, but I worked hard, very hard. Then another mission in the after tsunami in Indonesia, and then Liberia or Nigeria. Then I'm sorry, impressive one in Somalia.
Maria.
Then then this is I was president in 2012. It was 20 years anniversary of Dr. Visual's Japan. So this is the reason why
Wow.
I wear kimono.
Wow. And you do have three female members plus
Yeah,
you, four.
yeah,
Mhm.
two Japanese women, and then right side of me it's a Korean woman, medical doctor. The others,
Right.
how many? Two French men, one man from Swiss, and one from where? No, one from Australia, one from America. Yeah,
Oh, you have an international board
yeah,
for Japan?
yeah, yeah.
Mm.
Then this is my serious condition. It's my last mission in Syria. It's 2013. Yeah.
Wow.
So I cannot remember for that. Yeah, that's it. Yeah. This is maybe last mission. Yeah, that's it. I just closed.
Right.
Doctors
That's
Without Borders.
very, very impressive. You have a very rare opportunity to visit so many places and help the people there.
Yeah.
That's what I always um feel very honored to know someone who is from the Doctors Without Border, because I'm
Yeah.
not a medical doctor, and I always admire people who do much more than just their own professions.
Thank you. So as a surgeon, usually we work as a conflict area, like Syria or
Yes.
Somalia. And
Yes.
yeah, but
Is it dangerous to go there?
working in the hospital is not dangerous. We are protected. To go like Somalia, go to the field like a hospital, it's very difficult. There is some risk to attack our car.
Wow.
Yeah.
Okay. Mm-hmm.
Then in Syria, there is some risk for bombing from
Yes,
our
yes, for
house.
bombing.
Yeah.
So were the UN missions also there? Were the United Nations, they have some peacekeeping missions there that work with you or missions?
No, 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 no. We are very independent.
Okay.
But there is no chance to go inside Iraqi like 2003. But MSF, Doctors Without Borders, sometimes join for the meeting like organized by OCHA. It's I sometimes join for that kind of meeting or
Right.
collaborating work with the UNICEF
Right.
yeah,
Right.
WFP like that. Yeah.
Advice to young women, either it's young medical doctor or maybe young women who will join BPW in the future. What kind of advice you will give to young women today?
So this is talking about the pediatric surgery. The left side is I worked for National Children's Hospital in Tokyo. The right side, this is she's now 42 years old. It's she has two girls, but unfortunately she was done for liver transplant once, but next month she need to do one more transplantation. But we as a pediatric surgeon, not only for treat, I would like to support their life. That's it.
Wow. Does her
Yeah.
daughter also go to your hospital?
She always send me because her mother died. So I
Mm.
was invited to her wedding ceremony.
Mm.
Like
Mm.
I'm doing as like her mother.
Wow,
Yeah,
wow.
yeah.
Very impressive.
Then another one, maybe as you know, I received
Mm.
for the, how can I say, this
Mm.
award last year,
Mm. Yes.
that
Blue
for,
ribbon.
yeah, Blue Ribbon.
Mm.
Then before
Mm.
that, I Cabinet Office Women Challenge Award. And
Mhm.
then before
Mm.
2016,
Mhm.
there is the award of Miss Umeko Tsuda.
Mhm.
She founded for the Tsudajuku Daigaku, big university. And
Mhm.
same year, I was award was the Yayoi Yoshioka
Mhm.
Award for the first female doctor. She
Mm.
founded for the Tokyo Women's Medical University, like that. So
Wow. Mhm. So you follow many great female leaders
yeah,
and receive the
yeah,
award, and then you continue to practice.
that's right.
Um,
So my colleague was my friend and my family is very happy to know that. And then I hope
mm.
my successor will follow that. Then this is another motto is think and act globally. I
Mhm.
I participate also for the United
Mhm.
Nations uh,
Mhm.
conference, and
Mhm.
this is I visited for Egypt or Cairo as an exchange
Mhm.
program. Maybe you can know this
Mhm.
is
Mhm.
uh, this one
Masako?
is Masako. Next to
Yes.
Masako is Mrs. Mubarak. We visited
Oh.
her house. Yeah.
Mm.
Then
Okay.
this is BPW International Congress in
Yes.
Cairo
Egypt.
and Jeju.
Yes.
So the BPW Nagasaki was founded in 1986. I
Mhm.
joined for the I maybe I am the longest member.
So you are
So
the
this
founding members when they
yes,
created.
yeah.
Wow.
The number of
Mm.
the photo. This is the uh, first president of BPW Nagasaki, second president like that. Yeah.
Mm. Okay.
Then this is yesterday's photo. That this is
Yesterday. Oh, equal pay
yeah,
day.
equal pay day. Today is a equal pay day of BPW Japan.
Mm.
So we gathered for our young
Mm.
members temple.
Mm. Mm.
Yeah,
Yes. I can see her.
yeah.
Yeah.
This is our
Thank you so much. About equal pay day, what is the equal pay day for Japan?
what
Which
is
day?
today.
Do you know which day? So
Because
April. April.
no,
So
this is,
April
we
27th.
always calculate when. So last year May 2nd, but this year April 27th. It means
Mm.
wage gap is
Yeah,
becomes
shrinking.
shrinking.
Mhm. Ah, that's
So
great. Hmm.
after this interview, we
Hmm.
will have the
Mm.
uh, meeting with all member all over Japan about equal
Oh,
pay
oh,
day.
really?
Yeah,
Okay, equal pay day.
yeah,
Yeah, that's a very great activity. Yeah. Thank you very much for all the sharing and then your encouragement and also your action. I think your actions speak louder than many words. We can
yeah,
see you in many pictures in many countries, and then you make a very brave decision to devote into your professional life. Much more than a medical doctor, you care for the patient's life, and then try to accompany them during
mhm,
their life journey. Yeah.
yeah.
I
So
really admire
yeah,
your action.
also that the doctor is just treat for the disease,
Yeah.
supporting for the
Mm.
social life or the
Mm.
future.
Mm.
So it
Mhm.
means my activity in BPW will help
Mm.
them, especially for
Yes.
the female patient.
Yes. Yes. Female patients.
Yeah,
Thank you again for joining our Her Footprint
thank you.
programs. Yes. And then we look forward to the interact more with you in the future. And hopefully I can visit Japan
Yeah,
maybe
you said to me
soon or next year. Yes.
next year, and
Yes,
see you
next
in
year.
Malaysia.
Yes, see you in Malaysia. Thank you very much for the
Thank you very
interview.
much.
Thank you. Bye
Thank you.
bye.
Hey, hey.